Hi everybody, here is Dr. Zainb Adil and there is simple explanation for glaucoma subject. Glaucoma is a condition of progressive optic neuropathy for which the intraocular pressure is the only modifying factor. So, it is not only the elevated intraocular pressure that could be cause the progressive nerve loss in glaucoma, but it's considered to be the main blaming factor. We have angle anatomy. What we mean simply by angle anatomy is the angle of the anterior chamber, which is between the cornea and the iris. And inside this angle, there is actually 11 structure, and these 11 structure can be diagnosed clinically by a maneuver called gonioscopy. IOP, it is intraocular pressure. It is one of the factors that maintain the ocular tamponade. IOP depend on three factors. One of them is the level of aqueous humor formation, and as you know, by non-pigmented epithelium of ciliary body. The other one is the effect of trabecular meshwork drainage, and the other one is episcleral venous pressure. Hi again. This is the anatomy of the angle of the anterior chamber. As you see, the first layer, this is the cornea, and here is the iris, and this is the angle of the anterior chamber. The space here is between the lens and the iris, and this is the site of formation of aqueous humor, where it passes anteriorly through the pupil into the anterior chamber, and this is also the site of drainage. As far as the fluid is formed, it should be drained to maintain the ocular nourishment and to keep, as we mentioned previously, the ocular tamponade. The way for drainage of aqueous humor by two pathways: trabecular, which is the conventional, the main way, about 90% of aqueous humor drained by this maneuver, and the other is uveoscleral, which is passed through the suprachoroidal space. And here, this is the structure that we mentioned previously. This is a picture, gonioscopic picture for the angle of the anterior chamber, and you can see the brown color is the iris, and then there is scleral spur, and the yellow arrow refer to the trabecular meshwork. Here is the route for aqueous outflow. How to approach patients with glaucoma? Any patient we should approach by visual acuity and by IOP measurements, by gonioscopy. Glaucoma is a symptomatic disease. The only condition that is symptomatic type is acute angle closure glaucoma or acute congestive angle closure glaucoma. In this condition, the patient will present to the emergency department in a condition of painful impairment of vision. The patient yawing from pain. Even the presentation could resemble the presentation of acute abdomen. Otherwise, the clinical presentation of patient with glaucoma is null. Usually, we accidentally discover the patient in the casualty during routine examination. We measure the intraocular pressure for the patient, or we send him for visual field examination, and we found he had limitation and he have pathology. There is as any other disease, glaucoma have many risk factors. Could be hypertension, diabetes, rhinoid phenomena. The drug can be a risk factor, and when we have a glaucoma medication, we will explain to you how many drugs can affect the level of intraocular pressure. Treatment of glaucoma involve medical treatment, and then involve laser treatment, and also involve surgical treatment. In condition of medical treatment, how we start to choose the agent according to the patient clinical condition. We start with single agent, and then measure intraocular pressure, and